this manual resuscitator for giving 21% of oxygen to the patient. So it can deliver from 21% to 100% when we have oxygen supply and when we have reservoir bag attached to it. Now, most of the manual resuscitator, they prefer the reservoir bag attached to it to increase the oxygen concentration and keep it portable and to be used without even the supply of oxygen. Okay. Now, let us talk about this mask, the patient interface. Bag we talked about the non-rebreathing valve, and now let us talk about this mask. This mask we use as the patient's interface to create a seal for positive pressure ventilation. If you see this mask, it has a narrow tapering end and a broad end. Okay, this guides us how to place the mask on patient's face. The narrow tapering end goes on the nasal bridge and the broad end is on the chin. And by something called C&E technique, we create a seal. So let's say if it is applied on the patient's face, the thumb and the index finger is on the body of the mask and the other three finger is on the bony prominence of the mandible. By upper two finger, we put the pressure downward, and with lower three finger, we pull the face of the patient and try to create a seal, right? So this is how we create a seal.